Sanibonani babukeli emakhaya siyanamukela kulo uhlelo lethu esilithanda kakhulu i-holistic healthy living lapho sifundisana ngezempilo. Yes, you know, when you see my face, it is Friday, it is 5 o'clock, and we are doing this again, teaching you more about your health so that you can take better responsibility for your health. Masikumbula, good. The last week we were talking about really important things one should know if you are faced in some emergent type of a situation. And it was amazing. We had Impoma Care. We loved it. Sifundile. I hope ugutinani nifundile. Today we are going to be talking about something very important yet very neglected. And I have here with me Dr. Sfiso Mazibuko. Kanti ngiyathemba ukuthi sekumbula ukuthi mina nguye uzinhle waka Mazibuko. So we have one of our own, Dr. Sfiso Mazibuko, and he is a specialist urologist. He is a consultant and works at Tembisa Hospital. He also works at the University of Pretoria, where he teaches medical students like myself. Kanti, he also has a practice that he runs a Malahleni in Witbank. Yes, you can actually go there and see him, and he will tell us more about what he does and what he loves and exactly yena urologist iyini. Dr. Mazibuko?
Hello.
How are you?
I'm fine. How are you?
Very well. Thank you. Sakwamukela ehlelweni lethu i-holistic healthy living.
Thank you very much. Thanks for having me. Good to be here.
Lovely. So you are a urologist.
Yep.
Yini urologist?
A urologist is a doctor that specializes on the urinary tract plus the male reproductive system.
Okay.
Yeah, so we work from the kidneys, bladder, down, and the reproductive system of a male.
Okay.
That's us, yeah.
And the reproductive system of a male.
Of a male, not a female. Yeah.
Okay.
The female ones is the gynae that focuses on that. Yebo, ama-gynae now.
Okay, so nina nmagaini wabesilisa.
People don't like it when you say it that way, but you know,
I am
something,
so sorry.
something like that.
Yeah, just to go to the context, because sometimes
Yeah,
we, you know,
true.
a lot, because really one of our main things in the show is really we want to teach health in a way that umuntu ohlele ekhaya azokhona ukuthi azwisise. Because
Yeah.
a lot, you know, people are like, yeah, no, mara labo doctors bezo nokuthi bathini ini bayakhuluma kodwa sizwa. So we really are trying to give it to them in a way that they will be able to understand.
Definitely.
Okay, and we hear Oguti. Okay, no, let me not. You tell us the things that you are passionate about, please.
Of course, I mean, the things that I'm passionate about is my work. Like you said, I'm a specialist urologist at the University of Pretoria, consultant in Tembisa, also in private practice. I'm passionate about that, urological oncology. Like today we're talking about prostate cancer, one of the things that I'm passionate about. Of course, male reproduction and sexual health, you know, things that affect men nowadays. I'm passionate about dealing with it, confronting it, and helping society, you know, overcome those kind of challenges. Yeah. Like I said, all I own, I told you that I'm passionate about jazz. I'm a jazz enthusiast. Yeah, so that's me.
Niazizuela, nah, straight from the doctor himself. Now, Doc, I need to ask you, why did you choose, particularly going into men's health? Why urology? There are many things you could have chosen, but you chose this route.
You know, it's something that's very close to me. I've got a family that's full of boys, you know, full of men.
Okay.
You know, so I mean, I saw the need, I saw the neglect, I saw the ailments, and you know, I found it easy dealing with the men and dealing with their issues. So for me, I mean, it was an easy choice to go straight to urology. You know, I found it easy. I saw that I could have an impact in urology since it's something that is very close to me. You know, having uncles and cousins, brothers, you know, huge extended family. So, yeah, for me it was second nature.
Wow, and definitely you having an impact namhlanje khona lana, and you're reaching out to millions of viewers out there. kanti ke nathi siyabonga kakhulu. So singabi ke nje sisamosha nesikhathi. You just mentioned briefly ukuthi, you know, you found it easier to deal with male issues, and one may think, aw kanti abantu besilisa they have issues.
Yeah.
Because you know, usually it's abantu besifazane yibo abagulayo, yibo abane high, yibo abane in, yibo abangakhona ukuzala. I mean, yibo. It's always more emphasis is put on the females.
Yeah, it's like that, and unfortunately, and men do have issues, a lot of them. I mean, you can see what's happening in society today. You know, the psychological issues that men have when you look at gender-based violence, abuse, and stuff like that. Men are implicated. You know, some of the men slowly they are beginning to come out. You know, to express how they feel, to express the kind of elements that they have, and it's a lot. I mean, the community is overburdened by, you know, male-associated diseases, and yeah, you know, it's a lot, yeah.
And now, Doc, in your practice, in your experience thus far, do you actually see males coming in to consult?
Like I said, it's, you know, it's still not enough.
Okay.
You know, it's still not enough, but there is a little bit of change. There is a little bit of awareness. I mean, work has been done over the number of years. It's still difficult, you know, it's still difficult. Those who are coming, they are referred or pushed. It's either by a spouse or a relative. So you still don't find men coming on their own to consult. So it's still not enough, but there is a bit of change, I can say, yeah.
Wow. And I guess we definitely need to really break the stigma again, you know, against that, surrounding that. So good say, you know, this is strong. I see. Is Siyabonga ukuthi we have doctors like yourself who really are passionate about male health and do raise awareness about such. So today, Doc, you said we're going to be talking about prostate cancer.
Yes, yeah.
Okay.
I think also BPH.
And BPH.
Prostate enlargement. Yeah.
All right. So let's start with the BPH. Please, BPH So what are we talking about?
No, when we talk about BPH, it stands for benign prostatic hyperplasia.
Okay.
It basically means there's an enlargement of the prostate. So there's multiplication of the cells, you know, within the prostate that causes enlargement.
All right.
And if the prostate enlarges, it impinges on the outlet of the bladder where the urine is supposed to come out, presses on the urine, and you get a patient complaining of urinating symptoms.
Okay.
Yeah.
Doc, kancane nje ha. Prostate. Umuntu akazi ukuthi inkosi yami yini prostate, kanti ngine prostate angaze ngayibona ikuphi yini, please.
I-prostate ngabeka kanjani ukuthi iyisitho somzimba emntwini wesilisa. If you look at, you've got a bladder.
All right.
That stores your urine.
Yes.
That urine is supposed to come out and then you pee it out.
Yes.
So where it passes, there's a prostate. Just in front of emlonyeni where bladder, there's a prostate.
Okay.
Prostate is a gland. Okay, it's a gland, small size gland, and the most important function here, it's involved in the reproduction system.
Okay.
So it forms part of the production of the semen. All right. So iyathaga ukuze umuntu wesilisa akwazi ukukhulisa umuntu wesimame. All right. So it secretes what we call a PSA, uketshezi. Okay? So that yenza i-semen yakho ingabi chappies, like inga sticky, ibe smooth, ibe runny, khona uzokwazi ukuthi laba abagijimayo ukuze kwazi ukuthi kuvele ingane bafike la baya khona.
So ibalulekile ne?
Kakhulu kabi.
Wow. Okay. Noma ingabonakali nje.
Noma ungayiboni, but it's very important. It's very important.
Because kakhulu abantu besilisa, it's all about the outward appearance. If no.
Yeah, no. There's a lot. There's
more to it.
Yes, there's more to it. Yeah.
Lovely. So BPH, Doc.
Yes.
Now ukhuluma ngama-urinary symptoms size so bangaba nama-urinary symptoms ukhuluma ngani so?
Yeah, urinary symptoms, there's a number of them. Akhona wasibaningi kodwa ke uma uzwa ukuthi ufuna uyochama normally uyazi ukuthi ufuna uyochama ufuna ukwazi ukuthi ubambe umchamo.
Okay.
Angithi udecide ukuthi manje sengifuna uyochama hamba ufike uma uchame kahle. So once uba nenkinga kwi prostate yakho, number 1 uma uzizwa unomchamo uzwa ngathi ujahekile ucindezelekile.
Okay.
If ungasuki manje uyochama umchamo uyayiphunyukela. Number 1.
Okay.
Number 2, uma ufika etoilet kose ufuqa, you need to push na you need to strain ukuze chameke kahle. Noma usuqedile futhi uchama uthi uyohlala phansi uzongathi hayi manje angiqedanga ukuchama ufuna ngiphinde ngibuyele futhi ngiyochama. Number 3, funa futhi mhlawumbe uma ukuthi uyachama uzongathi kubhlungu. Yeah. So there's a bit of straining and ufuna push and it's a bit painful for ukuthi uchama. Noma ulele ebusuku ufuna uvuke multiple times uyochama. So uyalala kuphinde uvuke uyochama. Nasemini wena kupheli nje 2 hours ungayanga etoilet. So those we call urinary symptoms.
Okay.
Yeah.
Okay. And then if umuntu aba this, when should one go seek help? If uyazibona ukuthi mhlawumbe uyasho umbukela amakhaya ukuthi lento kusayishilo khona nale when do I actually stand up ngiyofuna usizo?
Yeah, I mean uma usubona ukuthi lento engiphethe iphazamisa impilo enginayo angisakhona ukuhlala kahle nabangani kahle ngixoxela funa ngigijime ngiyotoilet manje no angisakhuliki noma kuthiwa ngiyahamba ngiseteksini sekose ngiphatha isigubhunyana or sekose ngimisa udriver once uqala ubona ukuthi kuba nenkinga ekhona kumele uhambe uyobona whether you go to the clinic or you go to your local doctor. That's also acceptable. So actually as soon as possible I should say kumele uyobona umuntu wezempilo.
All right. And now doc, kakhulu we are told ukuthi as one ages kunezinto ezenzakala and those things are normal. So at what age would there be an age where it is normal, and if not age la uyazi ukuthi okay then I need to definitely go seek help?
No, I mean urinary symptoms actually angaqala at any age.
Okay.
Actually.
Okay.
Yeah. As long as umuntu esilisa and as an adult you can have the symptoms.
Okay.
Because ngendlela esikhula ngayo siyahluka. Uyabo. Prostate sizes ziyahluka.
All right.
Abanye baqala basesebancane but predominantly siqala ukuyibona at the age of 40 going upwards. All right. But you can still have those symptoms earlier on.
Okay.
And if they occur earlier on, it could be a sign of something bigger that is underlying. Okay, so the earlier it starts, the more actually you should consult, because as a young man you shouldn't have these symptoms. If they start early, kumele usheshe uye kudokotela. So, but what we'll say at the age of 40, once you start seeing these symptoms occurring, and then 50, 60 they get worse and worse.
Okay.
Yeah.
And what would cause this, doc?
The enlargement of prostate is something genetic.
Okay.
Right? Into oyitholayo kokhokho bakho uthola ukuthi umkhulu ke wabanayo, now usually ubanayo. But it's normal for uma ukhula for the prostate to grow as well. So the more now ukhula, the more the prostate enlarges. So it's sort of a natural process. It's just kwabanye ikhula ngendlela ehlukile kwabanye abantu. Yeah.
And then manje what are the investigations that are there or that could be done to confirm this?
Okay. There's a number of them that awenziwayo. Obviously umuntu mayefikile umele axelwe ngudokotela. Obviously udokotela uzokuhlola. It's not a matter of check directly ku prostate. Funa bakubheke ukuthi unjani wena. Emzimbeni isimo sakho semzimba sinjani. Awunayo namanye ama symptoms. Inhliziyo isebenza kahle, amaphaphu asebenza kahle. Anything ezenzakalayo emzimbeni. So you need to hlole throughout the body, because kunamanye ama conditions that can be associated with this. Something like we call a metabolic syndrome. Ivamisile ukuhambisana ney'nkinga ze-prostate. So uma uyithola ukhuluphela uyithola ukuthi unoshukela, that's usually a sign ye-metabolic syndrome. So you need to be checked for those.
All right.
Specifically for as a urologist siqala sikuhlola umchamo. All right, ukhamini sithatha umchamo yakho siyahlola kunegazi emchameni kuneshukela emchameni wakho khona izinto esingayithola that are not supposed to be there. Is an infection in urinary tract system. Check lokuqala, and then we can do an ultrasound just to kuhlola ukuthi i-prostate yakho injani, i-bladder yakho injani, nama-kidneys wakho anjani. And then you can move on, and in certain instances where we do digital rectal examination. Oh, into engivamse ngathanda abantu besilisa, where a doctor will take his finger and insert it per rectum, la ngemuva, just to feel for the prostate. So uyazi ukuthi prostate injani, are the nodules, kunamaqhuba khona ku-prostate, is it irregular, is it soft? Ngoba zonke lezo zinto can indicate different kinds of diseases. All right, it's an uncomfortable thing, but it's something that needs to be done in certain instances with the consent of a patient of ours. Awuphoqwanga, but we usually persuade the patient that we need to do that.
All right.
Yeah. And the other investigation that we do, like I said, the prostate secretes what we call a PSA. Okay, the PSA can guide us, ukuthi what's happening with the prostate. Are the likelihoods of cancer being there or not? So we can use the PSA depending on what the value is of the PSA to try and predict if there are chances of having a cancer in the prostate. But for the purpose of BPH, PSA yakho can be high, not because you have cancer, but because the prostate is big and is producing a lot of PSA.
All right.
It can also tell us if you have infection, you've got prostatitis, your PSA can be high. So you can use that as a form of an investigation of the prostate. Yeah.
Okay. Now, Doc, how can one, you said it's genetic.
Yeah. Yes.
So one can't really prevent it.
No, not really. You can, you cannot really prevent it.
Okay.
Yeah, there's no way you can, there's something that you can do, but I mean, that's for a different show altogether. But you can't prevent it. Once your prostate enlarges, it enlarges. You can try and alleviate or reduce its size once it has happened. But you cannot say, I'm trying to prevent my prostate from getting big by, by doing 1, 2, 3, 4. But once you see the symptoms, there's something you can do to try and reduce the symptoms that you are presenting with. But one should stress that there are other things that you need to do to prevent yourself from having prostatic ailments from the kind of food that you eat.
All right.
You try and live healthy, prevent diseases like diabetes, like I told you about metabolic syndrome. So you try and eat healthily, exercise, so that maintain that good state of wellness for you to prevent yourself from having such kind of illnesses.
Okay. And now, Doc, quick question before we move on to the prostate cancer. So once the prostate starts growing, is it unidirectional? Like you can't halt it, or maybe, so once it got cooler, that's it.
Yeah, I'm not saying that it just grows and overgrows your body. No.
Okay.
It grows according to the hormones that you have in your body, because the hormones are implicated in stimulating your prostate and making it grow. Specifically, I'm talking about testosterone. When the higher you have your testosterone, the growth of your prostate, but with age it starts coming down. So the growth of the prostate is also halted. It reduces a little bit. It's not the same as when you're a bit younger. So the older you become, yes, there's growth, but it's not as much as when you're a bit younger.
All right.
Yebo.
Well, Babugeli Amakaya, I hope ukuthi niyafunda kanti futhi ngiyathemba ukuthi niyazwisisa, because really more than anything we want you to hear and then for you to understand, so that kusasa na uzokhona ukuthi uyofundisa nomunye. Remember what we teach, asifuna ukuthi ihlale iphelele la kuwe, but rather what you learn, what you know, ufundise nabanye. Kanjalo we are working towards a more knowledgeable community, a more healthier community. Now, Doc, prostate cancer. What is prostate cancer?
Prostate cancer, umdlavuza we-prostate, or the malignance of the prostate. When if cells a prostate, they become abnormal. All right, they start on eating other cells and spreads to other part of the body. It's a very common cause of death in males. One of the leading common causes of death in males. The reason why it happens is more often as well genetic. If you have first degree relative, second degree relative that has this cancer, you can also get it.
Okay.
Or if you have someone in the family with history of colon cancer, breast cancer, cervical cancer, the chance of you getting it are also high. There are other things that are implicated of causing prostate cancer, but they're not 100% proven, like if you have recurrent infections of the prostate, certain types of food that you eat, the overweight people, it is said that they are prone to having prostate cancer, but that's not proven. The one that is known at the moment is the genetic causes of prostate cancer. All right, like your first degree, second degree relatives, and other kind of cancers. If you've had them, you can also have prostate cancer. Yeah.
Sure. So basically, Doc, if you don't have first degree relative, one can't really tell.
You can, yeah. That's the thing. Yeah, you can't tell because more often asazi ukuthi obaba bethu ba, bashona ngasiphi isizathu. Uyabo. Uyatshela nje ukuthi hayi, washona wayegula, so you don't know exactly ukuthi kwenzakalani ngobaba wakho noma umkhulu wakho. So that's why it's advisable, especially when you are black, when you reach an age of 40, go get yourself tested, see your urologist or your GP akuhlole for any signs of prostate cancer.
Okay.
Yeah.
So when one gets to the age of 40, it is advised ukuthi bahambe bayohlolwa.
Yes, very much advised ukuthi bayohlola. The reason that we say 40, especially in blacks, is because prostate cancer is very aggressive in blacks. It spreads very quickly. It can lead to, to death, masishane. So it's very important ukuthi usihlole lesifo. See your GP, check whether uthatha igazi or do a digital rectal examination, abone ukuthi cancer ikhona na.
Okay.
Yeah.
Now, Doc, do we know why it's actually more aggressive in black people?
There are studies that are going on as to why. We don't know yet.
All
They're
right.
still investigating why actually it's more aggressive in blacks. But the other thing ukuthi it could be that njengabantu abamnyama azivamisile ukuya siyobona udokotela. So inkathini uma usuya kudokotela uya sekulate, isihambile, isigcwele emathenjini, isegcwele umzimba wonke, so that's why sibona ukuthi ngathi ihamba kakhulu ebantwini abamnyama.
Okay.
Yeah.
Wow, Babukela Emakaya, that was a mouthful, and I really, really hope that you are taking this and as seriously as the doc is emphasizing ukuthi ibaluleke kangakanani. You may be umntwana, you have a dad, you have a brother, umama unabantwana besilisa. Like, this is for everyone, it affects everyone. So if we know, then you are actually able ukuthi ukhona ukusiza, whether it's knowing ukuthi okay ubaba usendlulile ku 40, maybe mele ukuthi ayohlola. So it is very, very important that we actually do that. Now, Doc, please can you tell us ukuthi how would it present?
How would it present? Almost same as BPH.
Okay.
Not wonke ama-symptoms. You can get ama-symptoms of BPH, the symptom, but sometimes you might not get those symptoms.
Okay.
All right? So things like if you feel a bit of back pain, pain around the lumbar area, it might be a sign of prostate cancer. If wehla emzimbeni, it might be signs of prostate cancer. Once you spread isingena esinyeni, that's where you get most of these urinary symptoms, like you can't hold your urine, you have to go to the toilet all the time, you have to push. More often when you get those symptoms, because they're late. So you can also have prostate cancer coexisting with BPH. So you can have cancer on the side while you have the prostate that is enlarged, that's giving you those symptoms. So whenever you feel those symptoms, go to your GP, azokuhlola for everything. Akuhlole for, for cancer, akuhlole for BPH. So because those symptoms can overlap. But once you have bone pain, amathambo asabuhlungu, iqolo libabuhlungu, uyehla emzimbeni, uchama igazi, sometimes that might be signs of prostate cancer that has spread. So it's important ukuthi uhambe uyohlola kudokotela wakho.
Sure.
Yeah.
And now, doc, in such cases, is there hope?
Like for most of the cancers, kuba lula if uyithole kusase early. That's why sithi kumele uye kusase early kudokotela akuhlole when the age of 40 you start checking. If uyithole kusase early,
Yes.
you know there is hope. It
Okay.
could be completely removed.
Okay.
Izinto zishintsha uma seyidlondlobele. So isidlulele ku-prostate, isingenile, specifically uma sengenile emathanjeni. That's the common area where prostate cancer goes, especially the spine. It goes there. It becomes a bit difficult. There are treatments, treatment though that can prolong your life, but ngaleso sikhathi more or less isikhathi sesihambe kakhulu. I cannot say it's too late, but something can be done, but that your life could be shortened as a result of that spread.
Sure.
Yeah.
And doc, I'm gonna put you in a very tight spot here. By shortened, like what are we talking? If so, Uguti says, you know, isi spreadile, what is one looking at?
In terms of lifespan?
Yes, in terms of lifespan.
You know, one cannot say because it differs at where it is, which
Yes.
point it is. But, you know, lapho sikhuluma ngeminyaka less than 5 years. All right, talking about up to 5 years and below.
So it's that bad.
Yes, it's that bad. It's that bad. It can be actually shorter. You know, it can be shorter. You do have patients that don't even last a year. You get patients that last up to 5 years. But, you know, definitely once it has spread, your lifespan is shortened.
Okay. And so, doc, because Njoba Osho, usually once people start having, let's say, the urinary symptoms, segulate, or, you know, now you start having the pains and stuff, do you ever find cases where you catch it earlier on?
Yes, you do find cases that we come, especially the ones who come in earlier to the hospital and consult. Yes, yeah. So you do find those cases.
Okay.
And once you catch it earlier on, there's a number of options that you have. You can have surgery, which is the gold standard.
Okay.
It's got a good survival rate. If you catch cancer and you remove it completely, that's good. You know, so for those ones, usually surgery is the best option. There's other modalities that could be used that are less invasive, like radiotherapy, have brachytherapy that could be done. And then for those ones who come in late, there's also other options that they have, that hormonal manipulations, you know, to curb the spread of the cancer. But yeah, the best way is if a patient presents early and gets the cancer removed, it's got a better survival rate.
Okay. And now, doc, next question. Umbukeli makhaya mhlambe uyazibuza ukuthi, okay, doctor, earlier you mentioned ukuthi le prostate ibalulekile when it comes to the semen. And now if uthi I can get it removed or nizoyi manipulator or nenza ama chemo ini, could one then be infertile?
Yes, I mean the prostate is very important. It is very important in your reproductive system. Ngoba njengoba ngichazile earlier on, it has a role when it comes to, you know, liquefaction of the semen. If you do get it removed, unfortunately, you know, you take away the fertility as well. Not that one cannot have a child. Remember, you can't have a child normally.
Yes.
Okay.
Yes.
So you might need to be assisted in having that child.
Which is what I think, doc, we really need to emphasize because omunye mhlambe kama ngothi yo angakaqedi phela mina to extend, you know, umndeni wami. So it doesn't mean ukuthi all help is lost.
No, doesn't mean that. There's many options nowadays. Yeah.
There are many options. Babukeli emakhaya, please. Asingacabanga ukuthi there is just one way, and if laying asebenzi kuphelile, not at all. Zikhona ezinye izindlela. And now, doc, so the prognosis of prostate cancer, if it's always early, that it's good.
Yeah, it's
Can
definitely.
it recur?
After treatment.
Yes, asithi manje sayithola early, yakhishwa.
Yeah, if it's been completely removed, so all your prostate is gone.
Okay.
So you don't have recurrence there, unless there's a residual tissue that was left, or ibisi khona emadlaleni, the glands, and it was not picked up, so you can have recurrence. I mean, if you've had radiotherapy, you can also have recurrence. You still have the prostate there. It's just that, you know, it's being denatured by the therapy, so it can recur in that state. But if you've had the prostate removed completely, then you're good. There shouldn't be any recurrence if the whole of the prostate has been removed.
Wow.
Yeah.
Okay, that was really quite informative, and ngiyathemba ukuthi nani babukele emakhaya you really actually are learning. Now, Doc, see towards the end of our show.
Oh, is it? Are we there already?
We are there already. So now, as we're going to the end of our show, please, can you just briefly tell us, Uguti, and other things as urologists, other conditions that one can consult?
Yeah, specifically to men. Like I said, we focus in men, mainly the male reproductive health. So there we talk about testicular cancer. It's one of the big things in young men. We look out
in
for
young
that.
men.
Yeah, in young men. It's most common in young men.
Okay.
That's why we advise that men must examine down there, you know, feel for any masses in the testes.
Okay, Doc, please, I'm gonna just have to ask you, examine how? Who should examine? Like, what age do you start examining? And secondly, how should one examine?
Okay. No, I mean, anyone can examine.
Okay,
Put it
anyone.
like that. Anyone can examine.
All
You can
right.
examine yourself if you have a partner.
Yes.
Actually, you know, more often testicular cancer is discovered by the female partners.
Oh, okay,
Mababhiza abantu
interesting.
you know, basekhaya bayedlalela mawuthathinta abuza hawu yini le ngathi kuneqhubula, there's a mass there.
Okay.
Then more often you discover it like that.
All right.
But you can examine anywhere. When you're sitting, when you're in the shower, you just feel there's different part of the testes that we can, you know, educate the public about what's normal and what's abnormal. But if you feel something abnormal, it's important that you urgently present to your GP or your urologist to have a look and see if something is wrong. So in young men, testicular cancer common in young men.
Okay.
30 and below.
30 and below.
30 and below,
Sure.
it's quite common. So you need to check, you know, down there regularly. So that's one of the conditions.
Doc, what is regularly? How often is regularly?
Regular is actually all the time. You know,
Okay.
just feel yourself all the time. You never know. You might find something.
Once a
So-
week, a month, year?
Even every day is fine. Every day. You can do it every day.
Okay.
If you are, I mean, you have to wash that area.
Yes.
So have a feel.
Okay.
Yeah. So have
Okay.
a feel. So if I have to stick my neck out and say, I would say examine every day.
Okay.
Because you wash yourself every day, isn't it? Yeah. Just keep on checking.
All
You
right.
might miss something one day. You might find something.
Okay.
All right. So testicular cancer is one of the big things. The other cancer is penile cancer. Very important. Seeing a lot of it in males, especially RVD positive males. RVD, I mean HIV positive males.
HIV positive males,
You
okay.
do get it quite often. So that's one of the cancers that we look at. There's also cancer of the skin of the scrotum. You do find that the cancer of the urethra. You know, there's a lot. There's a lot of other conditions in males that have. Now, the condition I'm talking about is your malignant, your cancers.
Oh, okay.
But you do have other conditions that erectile dysfunction and infections and all that. So I'm not going to talk about those ones.
We're not going to talk about that.
Yes,
It's a
yeah.
topic for another day.
Yes, yeah.
Especially erectile dysfunction.
Especially erectile dysfunction.
Because
That's a big one. Yes.
it's something people are really struggling with. And as you said, Doc, like they don't talk. Males are, I don't want to say they're shy. I don't think they're shy. I don't think males are shy. I don't think males are shy.
Yeah, not necessarily being shy. Remember, as males, there's ego issues. Number one.
Agreed.
You know, yeah. I think that's the biggest thing. I'm a man. I'm invincible. I'm not vulnerable. You know, so I must appear like that. You know, so we try and portray that all the time. Actually, to an extent that you're actually even afraid to speak to other men about such others. So a man would rather die alone in his house than tell a friend,
Yep.
the father or the uncle or umkhulu. So that's one of the problems with males. But hopefully, in time, as we keep on educating, you know, men, things will change. You know, and there is a little bit of change that I'm seeing. Yeah.
Wow, and we
Yes.
definitely love to see that. Now, Doc, Sesivala, if one uyabuza ukuthi, okay, Doc, you said so much about BPH, about prostate cancer, and if there's one or two things that I can do really to just try and not get it,
You know, for any other condition, or say any other condition, a healthy lifestyle is very important. You know, like I said, you have diseases like hypertension.
Yes.
You have diseases like diabetes.
Yes.
You know, so you try and prevent yourself from getting those.
yes.
Live healthily. Stop smoking. Reduce the alcohol. Exercise. Eat healthily. Eat healthy foods with all the important vitamins. Avoid the junk food. Avoid the things that are not healthy to your body. You know, once you have all these, of course, balancing the mind as well. You know, mental health is very important.
Yes.
Make sure mentally you are sound, emotionally you are sound, and physically you are sound. The chances are good that, you know, you might not get these conditions, but even then, if you still have that, make sure that you see your GP, your urologist, your cardiologist early. You know, get yourself checked up, see if everything is still okay, especially if you have history of these cancers or any other condition. Make sure you see your doctor early, you know, for your examination to be done. Check your heart, check your chest, check your prostate. Very important.
Very important.
Yeah.
Siyabonga, Dokotela. For logo now, one may be asking, okay, if I want to see a urologist, do I have to see a GP first? Doc, can I come straight and see a urologist?
Yeah, and you know, fortunately or unfortunately, you know, specialists nowadays, especially according to the medical aids, you need to see your GP first.
Okay.
And then the GP will refer you to your urologist. Obviously, if you are a cash-paying patient, it's easy just to directly go to your urologist. But most of the medical aid, they want you to go and be seen by a GP who's going to refer you to a urologist for your checkup. Yeah.
Okay. And then, Dokotela, you mentioned you have a practice in Witbank.
Yeah, yes, I have a practice at Marahleni Private Hospital, Witbank. Yeah, together with all the other work that I'm doing. Yeah, this my practice in Witbank. Yeah.
Okay. And so, social media, nyana kona la, otolagala kona, if I want to know where is your practice, who can I call? Like...
It's, social media, there is, you know, WhatsApp
Okay.
is there. Facebook is Mazibuko. That's the name of my practice.
Mazibuko.
Mazibuko.
Okay.
Yes. Yeah, we're still working a lot on those. I'm not good when it comes to social media, but my people are working a lot towards that. But you can find us on the net if you search for Dr. Mazibuko. You should be able to find us. I don't know, details, I'll leave it with you so you can broadcast it. Telephone numbers so that you can get in touch with us. Yeah.
Definitely, siyabonga. And Doc, please, amakama wako wogu, you know, your final words to the viewers.
Like I said, prostate cancer is real.
Yes.
You know, get yourself tested, live a healthy lifestyle. Let's defeat this disease. It's possible. As a man, come forward. Don't be afraid. Get yourself checked out.
Wow, I love it. Don't be afraid and get yourself checked out. Doc, from our side on Holistic Healthy Living, siyabonga kakhulu. Thank you for your time and actually educating us.
It was my pleasure. Ngiyabonga.
Wow, siyabonga kakhulu. On our side, Holistic Healthy Living, siyabonga ukuthi benihleli and siyathemba ukuthi nifundile, siyathemba ukuthi you have something, you know, ongakhona ukuthi uyofundisa nabanye, siyabonga. And we also would like to thank our bishop and the lady bishop for giving us this opportunity ukuthi sifinyelele kini and teach you more about your health. Please, nihlale futhi nihlanganyele nathi next week, same time, same place, where we will be teaching you more about your health. You do not want to miss all the other shows. Please, singakhohlwa ukuthi we are still going through a pandemic. You need to always have your mask on, social distance, sanitize. Please, please, please stay safe. We love you. Thank you.